Okay. Good morning. I'm Dr. Steve Stice, Chief Medical Officer at the University of Kansas Health System. We're coming to you live from the Dolph Simons Jr. Family Broadcast Studio today on Open Mics. We see scenes like this almost every night on the news. After a while, we can get numb to the daily violence in our city and our country. But each of these violent crimes affects more than just those who are involved. It touches families, first responders, and even the medical professionals who have to deal with the aftermath. And the victims are getting younger. The question is, can anything be done to curb the violence, especially against our youth? To help answer that question, we've assembled an outstanding panel today. This is going to be a really important and vital discussion. With me in the studio is Dr. Robert Winfield. He is the Division Chief of Acute Care Surgery, Trauma, and Surgical Critical Care here at the health system. And unfortunately, Dr. Winfield encounters more than his share of violence. Several guests are joining us virtually. Dr. Jamela Watson-Thompson is an Associate Professor of Applied Behavioral Science at the University of Kansas in Lawrence, and Associate Director at the KU Center for Community Health and Development at the Lifespan Institute. Olivia Damaras is Injury Prevention Coordinator here at the health system. Julianne Van Loo is Director of the Wyandotte County Health Department and someone who's been a guest on our program before. And Damian Daniel is President of the Ad Hoc Group Against Crime. Welcome to all of you and welcome to this really important program. We can't do this program without you, our viewers. Start sending us your questions into YouTube, Facebook, and the Medical News Network. Those links are right here on your screen. Alexis Del Cid is monitoring those chat boards, and she'll bring your questions to our panel in just a little bit. We'll get to our main topic in a moment, but first, we have important and exciting news for those waiting for the newest COVID vaccine booster. The new bivalent booster vaccines have arrived, and the health system is preparing to give their first shots. For those of you not familiar with the term, bivalent means this newly approved vaccine is formulated to fight both the original SARS-CoV-2 strain and the BA.4/5 version of Omicron and those variants. Joining us is Adam Meyer, Director of Nursing at the health system. Good morning, Adam.
Good morning.
Now, usually when I see you, Adam, you're about to give me a shot. So today you're not giving me a shot, but in a couple of weeks you're going to here on this program, right?
That's right.
All right. Well, tell us a little bit about the boosters. How many doses do we have?
Absolutely. So we got our initial shipment from the state of Kansas. Actually, yesterday we got the first shipment in of our Moderna. We'll get the second shipment of our Pfizer booster in this morning at around 10:30. Combined, those are about 2,200 doses that we're getting, and those will go out to our primary care clinics initially, and we've already put in that second order to the state of Kansas to have more doses on their way.
Excellent. That is good news. And so are people wanting the boosters?
Yes, we're starting to get a lot of questions from not only our employees, but the community about getting the new booster.
Yeah, pretty good stuff that's out there. I know my daughter actually got her booster, I think influenza on the same day. So a lot of people are doing that. Talk to us a little bit. Who's eligible for the new booster? I know it's just slightly different between Moderna and Pfizer. Let's start with Moderna.
Absolutely. So Moderna is 18 years and older, and you have to have completed your primary series of a monovalent, or what we would consider those original series of vaccines, at least 2 months ago.
Yep.
For Pfizer, it is 12 years and older, and you had to have completed that series of that original monovalent vaccine at least 2 months ago. So it really does open up the broadens the span of who is eligible for the booster. But I think combined with the flu shot, this will be really good heading into the season.
And if I remember right, you have to be at least 2 months out from your last booster shot.
That's
and
accurate.
So it's not like I get a booster, go get another booster today. And just to say the other thing, we don't know how this will go in the future, I don't think. The original series is still the monovalent shot. We'll see if that goes to a bivalent shot in the future with both Omicron and BA.5. or Omicron and the original strain. But the original, your original series of shots is still the monovalent shot that was originally developed. It's got done incredibly well. It works incredibly well. We are so blessed to have these vaccinations. It has made such a huge difference in fighting this pandemic. and then the boosters or the bivalent shots. There's talk this may become an annual booster. In fact, it's kind of what the CDC has come out and said recently, and that you get it kind of like the influenza shot.
Yeah. Yeah, that's what we anticipate, and I think one of the great things about the booster as well is whether you've received Moderna in the primary series or Pfizer in your primary series or even Novavax in your primary series, you're eligible for the new bivalent booster.
Or the Johnson & Johnson
or the
primary
Johnson
series,
& Johnson,
or if you were even in
absolutely.
the AstraZeneca trial beforehand. Yep.
Absolutely.
So how can patients get this new booster, Adam?
Yeah, so we will be deploying the new bivalent boosters into all of our primary care clinic locations. We've encouraged patients to notify their provider if they are interested in receiving the new bivalent booster, and we are also working with Epic, our Epic partners, to make that scheduling available within MyChart as well, so that patients have ease of scheduling that shot in their primary care clinics and primary care locations. We also know that the state has Vaccine Finder, and we're a part of Vaccine Finder, so patients can go on Vaccine Finder and see all of the locations in their area that have the new bivalent booster. We would just encourage our patients to get boosted. It's like the flu shot. We know that vaccines work, and they work well at keeping people healthy. And so as we head into flu season, we're really encouraging not only the flu shot, but also, if you're eligible, the new bivalent booster.
And since just about everybody's now going to be eligible for the bivalent booster,
That's
by gosh,
right.
you need to get that and get it tied in with a flu shot together. And those shots are going to officially begin today. Is that right?
That's right. They officially begin today.
Awesome. Anything else we need to know about how to get those things scheduled? We got MyChart. We know how to do that. Anything else? Any other tips?
Nope. Reach out to your primary care provider. Again, utilize that Vaccine Finder on the intranet as well if you're looking for community resources. But we really encourage individuals to work with their primary care provider here at the health system and getting their flu vaccine as well as their bivalent booster if they're eligible for it. And certainly we are working to continue to increase access across the community as we get more and more doses each week from the state.
All right, Adam, thank you for joining us. And
Thank you.
we're going to move to another part of the discussion. We'll see you in a few weeks when you have to give me my shots on air again. Here we go.
Looking forward to it. Thank you.
All right. These guys love to give me those shots on air. I don't know what it is. Somehow they like to punish, I think. I don't know what that is. Hey, let's look at the heat map for the United States for just a minute. This is so much better than it was. There are still some of those pockets across the country that show the darker spots and the lighter spots showing less disease, and especially kind of up in that Kentucky, West Virginia, Virginia area, Ohio. But overall, it is markedly improved, and that's really good news. The other thing we know is that we aren't seeing another variant out there yet. That's not to say there won't be one, but Hawkeye, I'm encouraged because at this time last year, we already were talking about the Delta variant, and we were getting a little nervous about what was coming.
Yeah.
Right now, I keep looking. Nothing else out there so far.
Yeah, absolutely. I think that is good news. Obviously, there are surveillance networks around the world looking and doing sequencing, looking for new variants. There was, I think, the B.275 that hasn't taken hold here as it has in India or in other parts. It hasn't taken hold in other parts of the world. So, but I think, to your point, Steve, I think that is very good and interesting. Right now, we are only really dealing with BA4, BA5 variant here in the United States. And overall, across the nation, just as you pointed out, cases are going down, hospitalizations are going down as well. Unfortunately, here at the health system, we have 30 active infections, 7 in the ICU, 4 on the ventilator, 20 in that recovery period. We are going to try to do a deep dive into some of these just to really understand exactly how and why, or some of these transfers as well from other places. I know yesterday I saw a transfer who was admitted for respiratory failure for COVID-19, but they had had it for some time as well. So we're going to try to deep dive into that, and of course look at ages and vaccination status as well.
Yeah, because that's the data that really tells the whole story,
Yeah.
I think, is when we start talking about things like that. So COVID-19 illnesses have been reported to have reduced the U.S. labor force by about 500,000 people, based on a study's finding and the author's conclusions. That's a large number of folks, Hawkeye.
Yeah, and I think we're all dealing with it, whether it's day to day in our daily lives and our children's lives, schools, obviously for all of us, supply chain. I think that's a huge issue. And we know about that great resignation time period where people just left their jobs. But overall, COVID-19 has, significantly impacted our workforce, and it affects us on a day-to-day basis. So it was an interesting finding and conclusion there for that.
So we also know that about up to 20% of people have left the healthcare workforce, which continues to affect hospitals. It affects our ability to take transfers. It affects our ability to staff. It affects our ability to expand our other missions because we're spending so much money on PRN, or what we call contract labor. And that really can cripple for especially a small community hospital or a small rural hospital, and really be crippling. You pay so much money on contract labor that then you have to say, okay, how can I go take care of all the other things we need to do, behavioral health or primary care, mental health, et cetera, and it really can affect your mission. So we hope that this begins to change. We also know that the nursing school applications are down. I've been through this once before in my life around the HIV pandemic years ago, but when it's at its worst, before there was effective therapy. And I think the more we can do to be in this together, the better off we'll be. Make sure people get boosted, make sure that people are getting vaccinated, because there's no question that that works. You went through the data this morning, and I was looking at it last night myself again, and noticing that we have a higher proportion of patients in the ICU and even on ventilators now than we had. We got down to 15, 16 acutes. We're up to 30. Yeah. I don't know. That is not a trend we're seeing nationally, however, and I think you may be right. Some of it may be a transfer center question. So in Philadelphia, the benefits of COVID-19 at-home testing is now creating a new partnership, expanding across the HIV testing kits for people at home. Is that going to happen here, Hanh?
Certainly we'd like it to. I'm not sure of all the infrastructure and the plans going into it here. Certainly we can ask our partners from Wyandotte County and Kansas City, Missouri. I think it's a great program. Obviously, HIV is a 100%, nearly 100% preventable disease, and that means by first starting and identifying the current cases, identifying them quickly, rapidly getting them on very safe and efficacious antiretroviral therapy. Once you can do that, we know that when you are undetectable, you cannot transmit this virus. So I think it's a very good partnership, and I think we need to look at expanding that and being able to do that in our community for sure.
All right, important information, but considering another really important topic, we're going to return to what brought us here today. Violence is now one of the leading causes of death for young people. The Center for Disease Prevention or Control and Prevention says homicide is a leading cause of death for Black or African American youth. Each day, more than 1,000 young people, 1,000 across the country, are treated in emergency departments for physical assault-related injuries. An estimated cost of youth violence is nearly $100 billion, $100 billion a year. For youth who are treated through the University of Kansas Health System, a hospital-based intervention program is now providing support to these young victims of violence in hopes of reducing return visits to the emergency department. REVIVE, or Reducing the Effects of Violence Through Intervention and Victim Empowerment, is a collaboration between several groups. They include the Ad Hoc Group Against Crime, Wyandotte County Community Corrections, and the University of Kansas Health System, and a federally funded grant program based at the University of Kansas in Lawrence called THRIVE. That stands for Together Helping Reduce Youth Violence for Equity. This is great work, folks. Dr. Jamela Watson-Thompson, you're the principal investigator of this 4-year CDC grant. Tell us a little bit about the grant, and how does the CDC grant help expand the hospital-based violence intervention program efforts? What are some of your strategies?
Thank you for the opportunity to share about the Youth Violence Prevention Center, Kansas City. So as you noted, it is one of 5 national centers of excellence with the Center for Disease Control and Prevention on youth violence prevention. And ultimately, what the National Centers of Excellence are focused on is really through academic and community collaboration and partnership, how do we evaluate and examine and also offer support to address youth violence in our communities. It really provides opportunities for strategies such as the hospital violence prevention programs like REVIVE to be examined and to look at what we can systematically do as a region, quite frankly. And so looking at multiple hospital violence prevention programs in our area is one opportunity that is supported through the YVPC, or the Youth Violence Prevention Center, Kansas City. Additionally, it allows us to look at youth engagement strategies. And so how do we ensure conditions in which young people and those of us that work to support young people can come together and really wrap around in ways that address what we call risk factors, which increases the likelihood of violence. Or what we want to do is have more protective factors, which decrease the likelihood that youth will engage in violence. And so the approach that we are using at the YVPC-KC supports, which will allow us to continue the work that we've done with all these partners you see on the line over the past 5 years in a pilot in Kansas City, Kansas, Wyandotte County. The YVPC-KC, or the Youth Violence Prevention Center, Kansas City, will allow us now to expand over time over the next several years into 2 additional community areas, which we define as high school cluster areas or neighborhoods. So our approach is really based upon our Thrive approach, which is just to do what I mentioned earlier: increase protection and reduce risk. We do that through a systems advisory board, which I can share more about later, but it's over 40 partners that come together collaboratively to think about what do we do to promote community and systems changes through what we call change levers. Additionally, in our second component, we focus on the implementation of youth violence prevention programs in places or spaces where young people are, or where they may be if they have elevated risk for violence. And so that includes in the hospitals, so through our hospital violence prevention program, as we just noted, Revive, which I know that Dr. Winfield and Olivia will discuss more, as well as Damon Daniels. Additionally, we also look at what can we do to partner with the schools through school-based violence prevention programming, both within school and during out-of-school time. And then lastly, as I know Julianne can talk about, thinking about how do we align with other violence prevention efforts, so in our case, such as the Community Health Improvement Plan through community level strategies. We also then think about youth engagement supports. So how do we coordinate better out of school time supports for our young people and our families through addressing that fourth bucket, which is social determinants of health, education, college and career readiness, through a menu of programs with partners that are offered. And then lastly, ensuring that we're supporting navigation. I often say that life doesn't happen one problem at a time for any of us, none of us on this line, none of our young people either. And so how do we really provide the supports to help our young people to navigate, to both support their goals, but address some of the challenges that we're going to experience and be successful? And so Thrive is a comprehensive approach addressing multiple risk factors, increasing protection with multiple partners in our community. Is the only way that we can do it is through systems approach. And so the YVPC, we're really excited about, is going to allow us to more systematically examine that, as well as through collaboration with other efforts and funders in our local community.
So Dr. Watson-Thompson, you mentioned that violence or challenges don't happen or a life one problem at a time. That is so true. How do you teach that to kids?
Very good question. So that is why it's important to have a multi-component approach. So part of what we do, particularly through our network of out-of-school time partners through what we call a Thrive Youth Opportunities Collaborative, is really about how do we contribute to developing the necessary skills that we need to be able to oftentimes grapple with that. And that is a skill development opportunity. So a lot of what we do then is we work with our young people, particularly in 8th grade. So we want to be there for those pivotal transition years. So you're leaving middle school, going into high school, but oftentimes you're much more receptive at that point still of engagement. Staying with those young people through 1 year post high school, whatever that might be and might look like, so that we're also on that critical year once you're transitioning into adulthood. Because for youth violence prevention, we define that based on CDC for young people who are between the ages of 10 to 24 years of age, right? And we know that that's a pretty pivotal time that you're going through a lot of changes. And so that's why we need these comprehensive interventions that are focused on skill development and understanding, that are also focused on addressing environmental factors. And so it can't be, in our strongest opinion and what we know in the research, one approach at a time. We all have to contribute to approaches, but then we have to understand how we're stacking those approaches so that we're supporting the environment in which young people can thrive, in which they can succeed, in which they have the opportunity to both practice and demonstrate skill development in ways that are supportive, and that if they get off track, allows them to get back on track so that they can thrive, quite frankly.
I love it. I love what you just described. That is awesome. And I'm impressed you believe a middle school person is still somebody you could be teaching to. That is a great positive outlook. Impressive. My kids are a little older now, but I've been there. So, okay, who are
now
some
I have
of
a
the
high schooler, so yes, you can still teach middle school. Sorry.
Well, you just been through, I mean, those are great strategies. Is there like a bricks and mortar center someplace that you guys actually bring kids to?
So that's the other, I think, beautiful part of the Thrive approach that we're also supporting through the Youth Violence Prevention Center Kansas City. What we really try to do is ensure that we are both investing and both supporting the many existing efforts that are already serving young people. But oftentimes what happens is as young people get older, when a child is in elementary school, the parents are there, the young people are there, it's easy to know the opportunities. As they get older and young people also start to make more choices, it oftentimes becomes a little more decentralized, let me say it like that. And so a large part of what we do, to answer your question, is there a brick and mortar for the Youth Violence Prevention Center? We have offices that our Thrive staff are based in. Damon Daniel has offices. Many of our partners have offices, but or programs or approaches. But the real approach of it is to be able to further help our young people to be channeled into the many programs, the many opportunities, the many partners that we already have. So to answer your question, yes, we have offices, but no, there's not necessarily like one designated center, because we are all the center working together, and we want our young people to navigate through all our resources and supports because they need all of them. And so that's really the glue we try to weave, to answer your question.
That is remarkable. I can see why the CDC wants to fund your work. It's brilliant. Thank you. So you've got some of the key partners you're mentioned. How do you align those efforts with other community efforts in Kansas City?
So I'm glad that you asked, and I'm also glad that some of those key partners are on the line today. But what we also know is oftentimes when we think about both investments and when we think about both our strategies, they're oftentimes a little fragmented unless we're very intentional about aligning it. At the end of the day, we're all trying to contribute to addressing the same outcomes. We want our young people to stay alive. We want them to be able to be successful. We want to see them less in the hospital. But it takes all of us taking our piece of the puzzle and laying it on the same puzzle board. And so through the Youth Violence Prevention Center Kansas City, that's based upon our Thrive approach, and even as we're thinking about expanding into additional communities based upon school neighborhood areas, it's important that we align with an institutionalized violence prevention as approach. So part of the work that we've done and have been blessed to do over the past 5 years, particularly in Wyandotte County, is aligning with our community health improvement plan, which I know that Julianne can talk about. Some wonderful work that I would say that collaboratively the Thrive Collaborative has supported in partnership with the health department in Wyandotte County and many others, is that now our Revive effort, our youth engagement strategies are part of our community health improvement plan, which means that they are recognized as a part of our approach for our community to address youth violence. Additionally, there are efforts in Wyandotte County in the schools, such as Enough is Enough, which is a school-based violence prevention strategy to really promote awareness. And so making sure that we also understand how to support alignment through our community strategy of addressing violence prevention. Alive and Thrive in our community is a effort to really think about how to address trauma. And so once again, when we think about the trauma and how we prepare even as staff or partners, we're leaning into Alive and Thrive as well as efforts through the school district. So those are just a couple. Additionally, we're trying to go upstream. The Center for Disease Control and Prevention will also tell you that early childhood matters. And so working with a new initiative called Kansas City Brain Builders, which is focused on increasing language literacy of our children, meaning before they enter school. Additionally, in Kansas City, Missouri, and Ad Hoc Group Against Crime, and Damon Daniels works with me kind of on both sides of the river. But in Kansas City, Missouri, there are efforts that are being supported, a 360 model. And so within that, that's thinking about violence prevention broadly. So our contribution is how does the youth violence prevention with many other partners already in the local community begin to align, as well as with Jackson County Combat. And so what we really try to do using the Thrive approach and through the Youth Violence Prevention Center Kansas City is we're not reinventing the wheel. We want to be a thread, quite frankly, that helps us to have really a stronger collective approach. And so it's important that we align. We're not the new shop or the new game, but we are thinking about the alignment because that's how we institutionalize, that's how we sustain. But ultimately, that's how we contribute, all of us, to improved outcomes. Either we contribute together and our young people succeed, or we don't contribute and they don't succeed. And that's a collective, either success or it's a collective challenge.
Yeah, you bet. So Dr. Winfield, Alive and Thrive, I bet you'd like to see more of that. As a trauma surgeon, you've seen plenty of the opposite with violence against youth. It seems like gun violence is becoming increasingly common. Is this perception reality?
Yeah, I think the data are pretty clear about that over the past several years, we've seen a national increase in the numbers of patients who are injured through intentional gun violence. And gun violence is a funny term. People will say that any act committed with a firearm is a violent act. And so we see increases in suicides, we see increases in homicides And yes, it is a fact that we are seeing an increase in those numbers.
And here are some of the examples of the kinds of damage caused by handguns. Tell us a little bit about what we're seeing.
Sure. Yeah, so here what we've seen is a gunshot wound to the abdomen that traverses the pelvis. And so this is a CT scan of the abdomen. What we see there, those white pieces that are kind of at the bottom of the screen, that's the pelvis and the spine. And so what we can see there is that that shattering of the spine there entering the pelvic area. And so this patient had a life-threatening injury secondary to a gunshot wound.
Yeah, that's tough.
This one I can't totally see. Looks like we've got an extremity gunshot wound, and so what we can see is a shattered maybe femur. It looks like, so a gunshot wound to the leg with a comminuted fracture of the femur.
Yeah, so that bone's it's in many pieces there,
Yeah,
kind of like the
destroyed.
pelvic one we saw too.
This one is a gunshot wound to the face, and so what we see there at the top of the screen is soft tissue damage from the bullet traversing the face, and then as you start to move downward on the screen, we can see shattering of the facial bones and some of the bones in the neck as well.
Yeah, this just hurts my heart to see kids like that. That's tough.
Agree.
Based on some of the data I've seen, rates of gun violence track with different things. They can track with what race, what income, education, similar to other disease states. Gun violence, is that a disease?
So I would say that all of trauma is a disease, depending on how we view things. I think in this case we're talking about a disease that has to be approached with a public health mentality. And so we can look at it from the standpoint of disease and disease prevention. When we think about trauma, over half of trauma deaths occur at the scene. So those patients never have an opportunity to make it to a trauma center. So prevention ends up being a big key. Trauma systems then end up being the next piece, so that the people who are injured, who can make it to a hospital, getting them to the right place at the right time, having the right treatments available, that's kind of the next step in management. But if you use an analogous example, motor vehicle fatalities, dating back to the 1950s, people recognize this as a problem. They begin to take multiple steps to prevent deaths from motor vehicle collisions, improving car safety, improving highway safety, stopping people from drinking and driving. And we saw a decades-long decrease in the number of people who died from motor vehicle collisions. The same thing can be true when we talk about interpersonal violence and we talk about firearm deaths in general.
Yeah, it is a disease, and it's one we have to confront head on. And we also have to try to repair some of the effects of that. Olivia Damaris is the health system's trauma injury prevention specialist. You're also the program's hospital coordinator. Olivia, how does this program help break the cycle of violence for young people?
So Revive, our program, is really focused on social determinants of health. So it is for 12 to 24-year-olds who are victims of violence that come through our health system. And we make those referrals to our hospital responders, which are ADTRAC Group Against Crime. And they take those referrals and those participants and they help them improve their social determinants of health. So that could be safe housing or access to food. It could be educational programs, all of the various programs that Dr. Watson-Thompson was talking about. We really provide a comprehensive wraparound service after they leave the hospital. And the goal is, by improving those social determinants of health, or those protective factors, that they will not come back to the hospital re-injured by violence or participate in any retaliatory violence.
So how has the program evolved, Olivia, since the launching in July of 2020?
Yeah, so we planned on launching the spring of 2020. COVID-19 pandemic had different plans for us. So we kind of paused and reevaluated and decided the best thing to do was to launch the program virtually. So we launched in July 2020. And the hospital responders since then have been responding virtually, meaning when the referral is made, the advocate responders are either having a phone call or texting or setting up some sort of video conferencing between the participant and themselves to start building that rapport. Our goal is to start transitioning to in-person responding in the coming months, which is a really exciting new push for us and the Revive program. And the other thing that we've evolved from during our pilot year, we had eligibility criteria that narrowed it down by residents. We really focused on residents of Wyandotte County, and in order to be eligible for Revive, folks had to live in Wyandotte County. Since then, we've noticed that there are folks from all over the metro that come to KU for violent injuries. So we've expanded that criteria since the first of this year. And now we accept anybody ages 12 to 24 who has sustained a violent injury, regardless of where they live. And I'd like to note also that violent injuries, while predominantly are firearm gun violence injuries, we also would include folks who have had any sort of blunt assault, whether it's by fists or some sort of blunt instrument, or any sort of stabbings as well. So we really encompass all parts of interpersonal violence in this program.
Well, thank you. That is a great sounding program, and I'm sure Dr. Winfield and I bet other members of our place here at KU love having this program available to help these young folks. Damon Daniel, the Ad Hoc Group Against Crime looks at the long-term picture for these young patients. Your team are the boots on the ground, people in the hospital. How do patients get connected with that program?
Well, thank you, and it's a pleasure to be here this morning. Good morning to all of you and the listeners and viewers of this program. So the social workers at University of Kansas Health, as well as Olivia just alluded to, even starting in January, chaplains will also be making those referrals to the Ad Hoc Group Against Crime. And so when they make that connection to us, our role is to really make sure that we're connecting with that patient within the 24-hour period, and then from there it's a matter of us setting up an appointment to go and do a official sort of intake with that person and doing an assessment in terms of the needs that they may have, and then explaining to them what the available services are for them as well, and connecting them to those services. And one of the things I like to mention is part of our goal in terms of connecting those young people and those families to those services is to make sure that we're doing what we call a warm handoff. And so it's less about us giving people a list of phone numbers or resources to call. It's more about us making sure that we have the right partnerships in place and the resources in place as well. So that means that we're going to make those phone calls on their behalf, and let those individuals know on the other side of that phone that, hey, we're making this referral to you. Here's such and such that'll be coming, and making sure that they get there as well. And so, in holding those referral partners accountable in terms of making sure that the services were rendered as we anticipated that they would be as well. And so that's part of the goal there too, is to make sure that when we're making those referrals, that folks are getting the services that they need.
Right. So once you get those referrals, what kind of things do you do with folks? How do you help these folks who've just gone through such a very traumatic event?
Yeah, great question. So part of what we want to do is to make sure that they are okay. And part of that means that, if they are experiencing nightmares, they're not sleeping regularly, things like that, we want to make sure that we connect them to our counseling services. And so we have free counseling services that are available for the family and for the individual that was directly impacted by that violent assault as well. And then from there, looking at making sure, that we're meeting the other needs too, and to make sure that they feel safe when they are returning home. And so part of that means that we are in contact with local law enforcement and other agencies to make sure that the persons who inflicted that injury are also being held accountable too.
Well, that is great work, and I think that this team is amazing. Now, the Revive Project is modeled after a successful violence prevention model out of Oakland, California, called Caught in the Crossfire. How is that being adapted here, Damon?
Well, I think part of what you see here is this collaboration of community partners coming together with a big goal in mind. And part of that big goal is to reduce reentry into the emergency room, as well as retaliation and overall youth violence too. And so part of that is everything that Dr. Watson Thompson talked about as relates to all of those, the broad community partnerships that are in place. And so that's one of the biggest ways in which it's being implemented here in the Kansas City area, is making sure that we have those community partnerships in place and the right resources for those individuals as well. And I think the other part of this is making sure, I think Dr. Winfield talked about this too, taking a public health approach to this is also important. I think the Cotton Crossfire model definitely speaks to that. And it is one of the, I think, most applicable in terms of programs for violence intervention when you talk about this approach to curing a disease such as violence.
As I hear this whole discussion, it feels like there's a group of folks who are working in the front end to try to prevent the virus from ever occurring. Folks here in the hospital ready to try and take care of you once the violence occurs, and then to help the mental part after that, and the trauma for the folks around that person, and then handing it off in the community to try and make sure these people are cared for when they get back out there. Julianne Van Loo, you're director of the Wyandotte County Health Department. We know that violence is not evenly distributed across all communities, and that is certainly the case here in the Kansas City metropolitan area. What does violence look like in Wyandotte County, and why does it look that way?
Sure,
and welcome back to
thank
the
you
program, by the way, because you've been on this program a lot, and we're always happy to have you, so thank you.
Oh, I love that public health is being included in this conversation. And what I love most of all is that I think 3 or 4 of you have already said the words public health approach to violence before I'm even speaking. So that's really encouraging to me that that's kind of catching on a little bit in the community, especially among our partners. But what violence looks like in Wyandotte County is a lot of what our folks have talked about, right? So if you are between the ages of 18 and 44 in Wyandotte County and you died today, the most likely reason that you died is because someone else killed you. So homicide is a leading cause of death for 3 of our demographic age groups in Wyandotte County. That's what you're hearing today, right? And it is impacting our youth more than anything, right? So in 2020, the average age of homicide in Wyandotte County was 30 years old. That means we are significantly skewed towards our youth. And that means if you compare this to other public health crises, we're losing a whole bunch more years of potential life lost because we're losing people at younger ages than if they had died later in their life. So this is just destructive to families, obviously to individuals, but to entire communities. And the other piece that we cannot leave out here is the impact that racism has on these numbers and the way that that's showing up in this, right? So in Wyandotte County in 20 and 21, the rates of homicide for Black individuals in our community are almost 4 times higher than the rate of white individuals. That is obviously unacceptable, but it speaks to, again, what Dr. Jamila Watson-Thompson is getting at with these risk and protective factors and the way that in Wyandotte County, especially, we've seen decades and a century of disinvestment in some of these communities. This is not happening by chance, obviously, right? Racism and violence don't happen in a vacuum. They happen because of the systems and cultures and the context that we have created ourselves, right? So the situation in Wyandotte is one of the most urgent, I would argue, in the metro area. There are obviously KCMO areas that have a very similar level of urgency, but the scale that we're seeing in Wyandotte and the intensity that we're seeing in Wyandotte is a really serious situation today. The last thing I would say about what we're seeing right now, we don't have the full figures for 2021, but in 2020, 52 of the 57 homicides were a result of gun violence. So back to Dr. Winfield's point around the gun problem that we have, it is the truth that we really cannot make truly meaningful strides systemically on violence until all of us on this call and our electeds are willing to talk about gun violence and what we do to start to prevent that.
Yeah, your statement. I have a son and daughters, and that statement that if you're young today, the most likely cause of your death is because someone killed you, is that just hurts to the core.
It does.
We are increasingly hearing about the need to approach violence from a public health perspective. What does that mean? And you've mentioned that, and I believe that, and I understand the concept. But help our listening audience, viewing audience, help them understand. What does it mean? It's a public health disease. It's not a political debate.
That's it. Thank you. It is not a political debate. That's exactly right. A public health approach to violence is not rocket science. It's actually very simple. And our other guests on the show have already demonstrated the ways that they are enacting that in practice today. So when we're talking a public health approach to violence, first we're talking about knowing the data. Who are we talking about? risk is not disseminated equally in our communities. There are risk and protective factors. We know what those are. We know that a Black person who's 20 years old in Wyandotte County is significantly higher risk of perpetuating and being the victim of violence than somebody who's a white person who's 60 years old. We know these things. So we take the data and the evidence that we have. We bring in community partners to then look at what are the proven approaches that have shown to work in the evidence across the country. How do we take the data that we have, those proven evidence-based approaches, and then use our own community members to help us tailor it for what works here, right? So it's very basic. It's use the data, it's use what we know, it's use the evidence, and then it's use our own community to be the voice, to give weight to which parts of these programs will work here, which parts won't, which parts do we need to modify for Wyandotte County, for example. And then we evaluate it and we assess if it's working before we scale it. So that's the other thing in public health. We need to be able to try out interventions like this Revive project they're talking about, right? They're trying this for 3 or 4 years to see if it works. We have to be willing to scrap projects that aren't proving that they're effective and not resource them. And on the other hand, when something is proving to work, like I think the Revive program is and is going to prove, we need to be willing to double down and invest in that. And like Dr. Jamila Watson-Thompson is talking about, scaling that out to a whole bunch of other different hospitals across the metro, right? So it's using the evidence, it's using the data, it's using our community members as the true experts on these problems, combining those together, coming up with pilots, trying them out, evaluating them, and going from there. So it's really just a quality improvement PDSA cycle at its core. It's just making sure that we're not using intuition and just what we think may be the problem and providing solutions that we think might be the solutions without letting the evidence in our community lead us to those correct answers.
Yeah, and I think it's important, you guys have pointed this out. This is not just a case of, quote, some people, end quote, being more violent than, quote, other people, end quote. And obviously there are a lot of euphemisms in that statement. But it's also clear that there's so many factors that go into this. And I love this. I love the fact that each of you have come together to work on this and treated it like a public health problem. Alexis, I have to tell you, I think this is one of the most important and vital programs we've done on this program. And we've done a lot of good stuff with COVID, but this is really key. I bet there's some questions out there.
Questions coming in. Isaac has a good one. Isaac would like to know from our experts if you had seen an increase in violence when everything closed during the pandemic, summer of 2020, the pools were closed, community centers were closed. Did you see an increase in violence? And then if you did that go down once things started to open back up?
Julianne and Damon, I bet you're well poised to help us answer that question.
I'm happy to, but Damon, please first if you'd like.
I think in some cases we saw more domestic violence than we did in any other case in some instances. Part of the challenge if we're just keeping it with youth, it wasn't necessarily. I'll let Julianne speak to the level of assaults and things like that as relates to the numbers. But what we saw was a lot of domestic violence as in terms of an increase.
Yeah, absolutely. We saw that as well. I would say for some youth in our community, those who had parents who had the luxury of being able to provide certain sorts of supports, we actually saw a reduction in some communities of youth violence because there were people at home with kids surrounding them, right? This is what led to an increase in that disparity. Because within the KC metro area, of single parent homes, 40% are Black, right? That means that those kids are the ones who were not provided with these wraparound supports around education, going online learning, all those sorts of things. So the violence may have come down for some during that period, which can be misleading. But if you look at the inequities, those became much starker because, again, those kiddos that are starting from behind with fewer resources, with fewer access to adults who support them in their life, to educational health supports, those are the kids who lost out. And those are the kids who you're seeing in these numbers that we're talking about.
Well, and it's tough, right? Because those parents are the frontline workers, are the people who are told, well, you don't have sick
100%.
days, you don't have COVID days, we don't give COVID pay, your health care you may or may not have, but you have to have 2 or 3 jobs to help pay for those things. And so at the end of the day, you still had to go to work, or so many other people could actually be empowered to work from home. And those are 2 very distinctive lives.
And if I may, Dr.
Go,
Stites,
please, Julie.
I would just like to put a plug in there that is a space that our business community can be participating in as public health supporters, right? Public health does not happen from within a health department, not even between all of us on this call today, right? Public health is built in the places where we spend our time. That's our jobs, our schools, our faith-based communities, et cetera. So if we want to bring in all the necessary partners to really hit home on this violence prevention topic that we really have to dive into here, we also need businesses to look at things like paid leave, to look at things like maternal leave, to look at things like allowing staff to leave in the middle of the day to take care of a kid who's in crisis, right? So again, to get back to that public health as that the violence approach of public health, this means that we need to bring in all kinds of partners, and it's even those whose businesses are for profit. We need them at the table as well. I think they're a piece that are often forgotten, but their business practices can impact violence levels in our communities too.
Yeah, I'm betting, Joella, that you see this with the kids who you're trying to help and you try to reach out to. All these things we've talked about, this is what you're trying to affect.
Correct. So we have it is what we're trying to affect, and we think about it, as Julianne and Damon and others have said, across domain areas. So we have to be able to make sure that we're offering supports at the individual level. We've already talked about that our young people have the knowledge and skills and the attitudes. We have to also make sure that we're thinking about at the what we call interpersonal level. So Julianne's just talking about the family home and the dynamics and the family management supports. Those are key. Additionally, the peer supports. We have to have more young people engaging with positive peers. That's part of the secret sauce too. Additionally, academic. We know that that's one of the key earlier predictors, quite frankly. And so making sure that, as Julianne just noted, that we have equitable opportunities in education and commitment. We also know that, at Julianne was just noting, and Damon too, at the community and the societal levels, our systems, our structures, our policies, all that plays in. And so what we're trying to implement are what we call change levers. And Julianne is correct. Through the Citizen Advisory Board, there's over 40 partners, but there can be many more that come together across over 14 sectors of the community: law enforcement, schools, youth serving organizations. We need faith community, business. Everybody has a piece of the puzzle. The question is, do you have your puzzle piece in hand? And are we putting it on the same puzzle board? And so you're correct. This is all part of what we're trying to examine collectively as we look at this.
And we all hold a piece of that puzzle to help put it back together. Alexis.
Kevin has a question. Kevin would like to know, it's a specific question, what ages are the patients that you usually approach for the Revive program?
So, excuse me, anybody who is 12 to 24 years old is eligible for the Revive program. Typically, we see 18 to 24, but there is an astounding amount of young people too, typically around that 15 to 17-year-old age that we see a lot of patients that are eligible for Revive as well. So while it skews a little bit to the older side, we, especially from Wyandotte County, there are a lot of teens that are injured from firearm violence specifically.
Olivia, talk to us for just a second. I can't imagine the conversation. You have a 15 to 16, 17-year-old person who thought they were invincible, whose life was turned in a moment. That has to be gut and heart-wrenching when you're talking to them.
Yeah, absolutely. Prior to this position, I was in the surgical trauma ICU for years, so I was at the bedside with these patients. And it's a life-altering event. It is a pivotal moment in their life. And that's why it's so important to have Ad Hoc Group Against Crime there at the bedside or in contact within that 24-hour period. It is shown to be this 24-hour golden window that we can make it a difference and we can make an influence in these folks' lives.
Alexis.
Ruth would love to know, Ruth writes, do your various groups speak to our legislators and other elected leaders?
Okay. Are you guys out there trying to work with leaders to try and get them to understand and help us with this? Damon.
Yeah, I've actually had conversations with local elected officials as well as the chief of police about Revive and what we're trying to do as well. In addition to local judges and things like that too, and district attorneys as well. And so yes, we've had those conversations, and a lot of them are very supportive of what we're trying to do.
And Julianne, I know that's a common topic for you within the city and within the unified government.
Yeah, we're always looking at policy options, particularly around safe storage of weapons and those sorts of things. Unfortunately, there's a lot preempted by the legislature in Topeka. So there's a lot that local governments have no authority or control over because those at the state have decided that that's not a tool that they'll allow us to use in our fight against violence. And so that's the unfortunate part. The fortunate part, at least in Wyandotte County, and I think Damon's getting to this as well, is that we're really trying to be a lot more purposeful in creating these teams at the local level. So we in Wyandotte County, working much more closely with our police department, our DA's office, the sheriff's department, all of those folks, in addition to our community folks. Because there's very often a disconnect between those who hold the power and the ability to make even just administrative decisions, which can have huge ramifications, and those at the county or the community level who don't feel like they have a voice at that policy or power broking table. And so I think a lot more of that is starting to happen, and the more that people in our own communities demand that happens, the quicker that will go. We all know that a lot of this is decided at the ballot box as well, and so people need to pay attention to the stances various politicians hold on various gun-related issues. This should be a voting issue for folks because it's that serious.
I have a COVID question from Lindsay. Lindsay Heron Anthony would like to know some more information on any studies that tell how long immunity lasts after a vaccine or a booster or having COVID. Her specific question is, have there been studies that show timeframes of immunity based on a control group? And if so, she asks, where can I find the results of those studies?
Okay, that's a interesting question because it's all about how you define immunity.
Yeah, and I think we need to do that. You know, most of what we hear in the news is immunity defined by antibody levels. Steve, just like you were saying, how do you define it? So we certainly know that with any infection, with natural infection or vaccination, we know you build up a very high titer of antibodies. That antibody level does wane and decrease. With the nature of the immune system, you have those memory B cells then that are able to, once identified a new infection, are able to get back into expanding and creating further antibody levels. But we also know that you have those memory T cells as well. So again, that's an insightful question. We know your immunity wanes, and mostly what they're talking about there is those circulating antibodies, but you still have the immunity from those T cells and those memory B cells as well. There have been a lot of studies. A lot of them are clinical studies. You know, they're published quite freely in things like New England Journal of Medicine, Nature, Science, Lancet Infectious Disease. Those are going to be some of the top journal articles. But what is your immunity? So what we know is that your immunity, you know, should be quite long, quite durable. But we know that immunity, especially those antibody levels, do tend to decrease or wane over the next 3 to 6 months after that infection or the vaccination. But with the arm of the immune system, that is the T cell arm, we have that cellular immunity so that when you do see that infection again, those cells are recruited quite rapidly to help prevent and decrease your risk of severe disease. We also know those memory B cells are recruited once they are stimulated by that infection to start producing further antibodies as well. I don't know if that answered your question, but there are a lot of significant studies about the durability of the immune system. But again, remember, the COVID-19, SARS-CoV-2 infections are relatively new, as are the vaccines, and so we are learning more and more about those things every day.
Yeah, it is an interesting question because we have so many different kinds of immunity. So let's, as we approach the top of the hour, it's probably time to turn to some final thoughts. Dr. Winfield, I am going to start with you. You have made a lifelong commitment to trying to work against violence. So thank you, first of all, for that commitment and for all the great work you do here as the head of trauma surgery at KU. Final thoughts.
Yeah, thank you for the opportunity to be on here today. Thank you for the opportunity to have our team on here today. I have to tell you, I've been doing this for 19 years now. I'm in my 19th year of doing this. I have treated hundreds, maybe into the thousands of people who have been affected by violence over those 19 years. And I have never been more excited about anything I've worked on than what this group that you've heard from today is working on. I really value the team approach. I really value the opportunity to partner, get outside of the walls of the hospital and partner with people in the community so that we can prevent these things from happening. Olivia talked about what a life-altering event it is. That's if we're lucky, it's life-altering, if we are able to save someone from a horrific violent act. So the key is to prevent this from happening in the first place, and you've heard from everybody today how they're working together to do this, and I'm really proud to be a part of that partnership and excited for the future of this across Kansas City Metro.
Yeah, that is approximately a very big deal. Dr. Watson-Thompson, final thoughts.
Yes, thank you. And I agree with Dr. Winfield as well. It is a great team, but I would also say that also in the community there, in my opinion, it's a spirit of collaboration as well. And so I think that's not always something that you experience all the time. But additionally, the one thing I would note is that through the Youth Violence Prevention Center, Kansas City, I think it also provides the opportunity to do what we're considering locally in Wyandotte County, but to also begin to think regionally to the extent that when we think about our young people and our families are oftentimes transient. So that means they might be from one community and then they move to the other, and that's all throughout the metro area. And so we do need to think about how do we weave across our approaches so that ultimately it doesn't matter which community you're in, we're not losing our young people and that we're staying with them. What we're even saying through being able to look at our hospital violence prevention programs across multiple hospital sites, our University of Kansas Health System site with Revive, additionally in Missouri and ad hoc partners, but Aim for Peace through the Kansas City, Missouri Health Department also works with 2 hospital sites currently. That includes research as well as University Health. And so what we're even saying in that regard is how do we think to look more systematically so that if one of our young people are ending up in one hospital system, that we're understanding and that we're navigating a little bit more collectively to understand truly our issues or hopefully successes in reducing readmissions to the hospital. And so part of that I just wanted to note is that both at our local level, but also expanding the opportunity, and we're in the process of thinking about what that looks like, but regionally to look at violence prevention and youth violence prevention as a public health program with both the multiple health departments, both in Kansas City, Missouri, Wyandotte County, multiple hospital violence prevention programs, and then of course the youth engagement, I think is also both an important opportunity that we hope that we can contribute to with many others to the Youth Violence Prevention Center. The last thing I'll note, puzzle piece, everybody think about which puzzle piece you have. At least through Thrive and our Citizen Advisory Board, Julianne noted through the Community Health Improvement Plan, there are many opportunities to get engaged. I describe it as a Thanksgiving table. We want everyone and we need everyone, right? And so if you're interested in how to plug in, you see behind me, wethrive.org. But there are many places that you can start to connect so that we can all be collectively contributing to a safer place for our young people where they can truly thrive.
Yeah, thank you for that. Julianne Van Loo.
I would echo, of course, what Dr. Watson-Thompson said. The only other thing I would add is that in focusing on violence prevention and these particular strategies we're talking about, we are not only going to impact violence, we're going to impact so much more than we're even thinking about today. We're going to reduce our mental health burden. We're going to reduce the serious opioid overdose issue that we're experiencing right now, right? We're going to help young people get educated enough to build a career for themselves. All of this stuff that we're talking about in the realm of violence prevention is actually just the keys to creating a healthy community. So I want people to think of this as not just a silo of working on violence. These are the interventions, the methods, the way that we build a community together. And again, I'll echo everyone else in saying that none of us can do really any of this work alone. And the collaborative nature is the only way we can be successful. So I'll also echo the thanks to my colleagues here today and KU for hosting the conversation. Thank you.
Thank you, and thanks for the great work you've done in Wyandotte County throughout. Olivia Damaris. I knew I was going to say that wrong one time. Olivia?
I'll say as a trauma ICU nurse for many years, I was at the bedside helping treat traumatic injuries. But now as injury prevention coordinator, I know the best way to treat traumatic injuries is to prevent them in the first place. And really that's the focus of what all of this is preventing them from occurring in the first place.
Yeah, I think that's what we were trying to say earlier, man. If we get before it happens, so we don't have to try and put it all back together. Damon Daniel.
Well, thank you for the opportunity to be here, and ditto for some of the things that my colleagues have said. This message is really for the viewers and listeners out there. One of the ways in which listeners that are out there can help us prevent violence is to teach the value of forgiveness. A lot of times what we're seeing amongst our youth is their inability to resolve conflict peacefully. And so one of the best things we can do is just get the message out there that forgiveness can go a long way. And if we do that, everyone can walk away safe. and whole as well. So thanks again for the opportunity to be here.
Well, thank you. Thank you, Brand. Thanks for the great work that you do. Doc Hawk.
Yeah, obviously, thank you to our guests on this very important subject, and would also like to thank the viewer who asked a question about immunity. So many details about that question. We know that as we are continuing to move forward through the pandemic, we know the safest way to immunity and protection is through vaccination. We know that we are still looking at information and collecting data and getting new knowledge every day. So very good questions, and we will keep you up to date on any new information that comes forth.
You know, we saw those films that you showed earlier, Dr. Winfield, of shattered bones, shattered face, pelvis. What we've really talked about today is shattered lives. And how do we prevent that? And how do we take care of it once they do happen? We can try and put you back together physically, but putting you back together mentally, that's a whole nother story. And I think the efforts of the great people in this program to do that and to help prevent violence, that is a great work, and it's work of the heart. And we so appreciate that you're out there doing it. I'm reminded of the power of grace, granting unmerited favor from one person to another, from God to us. If we had more grace in the world, I bet there'd be less violence. And to Damon's point earlier, how do you stop it before it starts? So thank you y'all for being with us today. What an important program. Alexis, what do you have coming up?
We have some news, Dr. Stites, about helping children who are exhibiting behavioral issues that appear to be caused by the pandemic. Researchers say it's one of the biggest issues affecting kids these days, and this goes along with our theme today. And now the University of Kansas Medical Center has a $9 million grant to fund the CanAware project. The money comes from Health and Human Services, and this project will focus on children in outlying areas of Southeast Kansas and determine the best ways to address these issues. And we also want to remind everyone that our annual Treads and Threads fundraising event is coming up this Saturday. Going to be a great event. It's a little different this year. It'll take place at the Truman Sports Complex in the parking lot between the two stadiums. It will feature all of your great and favorite foods and fun that you've come to expect in the last 20 years. And headlining the entertainment this year is Alabama. And then fan favorite, the Emerald City Band, will be rocking all night long on the dance floor. Remember, all of the proceeds from this event support the KU Cancer Center's proton therapy program. It's for a great cause. That's it for us today. We will be back here live tomorrow morning at 8 a.m. Make it a great day.
Coming up tomorrow on the Morning Medical Update, nearly 250,000 men will find out they have prostate cancer by the end of the year. But could this tissue-sparing proton therapy treatment be a good choice for these patients? I'm Jessica Lovell. We hear from 2 patients a decade out from their treatment and a local man just starting his. That's Thursday at 8. On the next All Things Heart.
And I did a biopsy, and it came back positive for prostate cancer.
What happens when that very treatment that could save your life puts your heart at risk? The questions you need to ask Thursday morning at 10.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.